make sure that you have a good mode of education. And when I say that is, how do you implement how the providers are going to get educated or identified for education? Meaning, when I went back to that new provider versus current providers, it's very important. So if you have new providers coming in, again, they're not just coming from resident programs and so on. You have providers coming from different entities and they have different ways to code. So it's very important that you identify, is it coming through medical staff services? Is it your directors, your area directors, your practice directors? That's very important to establish the modes of how your providers are going to get that education. We perfected how to get the new providers, because we have a medical staff services, so we could identify all of that. We do work on how do we get our current providers. We don't want to get them retrospectively where they're reaching out to us because they're having challenges, but how do we reach out to them when they're in their clinics and so on? So it's important to, again, I think the biggest one is, how do you get to your providers to make sure you can help them and assist them and say, hey, I'm here to help you with any billing question, coding educate question, because sometimes with ICD-10, all of the changes with Medicaid changes, Medicare not covering this, they need to know. So it's really communicating with your providers is the biggest takeaways. How do you do that effectively?